the coronavirus are really, growing around the region. And as an employee, you probably have some questions, about your job and keeping yourself safe. So we're actually here this morning with a local labor and employment attorney, Catherine Morissette. So Catherine, really thank you very much for being here. I know I have a lot of questions about this. We want to try to get to some viewer questions. So let's start with, when should employees be sent home? You said in the break, maybe have a plan before you even get to that point.
Absolutely. I want employers and employees to be working together to do what we can to stop the spread. There needs to be clear communication based on actual information. So what the CDC says, which is who we want to be counting on for our medical information, is that the first sign anybody shows symptoms, it's time for them to go home. And symptoms are usual, just like with seasonal flu. Coughing, fever, pretty much that's it. We have some rights I know that we're going to talk about in Washington and the city of Seattle about what we can do if somebody needs to go home ill.
Yeah, that's what I want to bring up next is when are companies required to provide time off? And does it have to be paid? Like, what are my rights when it comes to that?
So Washington law requires that folks are entitled to 1 hour of paid sick leave for every 40 hours worked. And even in the city of Seattle, we have that too, depending on employer size. You probably have that as well.
I do, yes.
So having symptomology like that means that you're ill. So you're going to have the ability to use your paid sick leave that's available to you or however your company's policy is.
At what point do employees have the right to stay home? I mean, sometimes there does feel like pressure, like, oh, I have to come in, or maybe it's not unspoken, but like, it definitely feels like you're being pressured to stay. And what are my rights to say, I need to stay home?
Yeah, so that's obviously a very difficult situation. So having a fear of getting ill wouldn't be something that's covered by paid sick leave or the Family Medical Leave Act or any of other leaves. At that point, you should be talking to your HR or your manager about why it is that you don't feel safe coming into the workplace. Most great employers have lots of plans in place about what they're doing for hygiene, wiping down surfaces, how they're handling travel. If people have been traveling to affected areas, and maybe they have a telework policy if it's the type of employer where that's available. So again, we hope we're having that dialogue so that we're not having the employee rushing in with that fear.
Yeah, that makes a lot of sense to me. What if I also am like looking at and I'm like, oh, I know you're short-staffed, and I definitely feel like, but I really do need to stay home. Is there any added pressure or any difference that makes if I look at, short staffing, for example?
Yeah, well, let's talk about the reason that you're staying home. If it's to care for a family member, you're going to have sick leave rights as well.
Yeah.
If it's because I'm afraid to come in, again, because I have this fear, you need to come into your shift just like you would any other day. And again, remember, we're using what we've used for seasonal flu to be able to sort of come up with how we're going to handle these things.
Really quickly, we only have a couple of seconds left, but I want to ask, how does this scenario interact with the Family Medical Leave Act?
Yeah, so we have our Washington's PFML, or Paid Family Medical Leave, and we have the federal law as well. So typically, that's not going to get triggered until somebody has a serious health condition or a family member does. So it wouldn't just be, I have a day where I'm not feeling so well. It would be obviously if you need to be in the 14 days quarantine or you actually come down with symptoms and are sicker.
This is really good information. Thank you. You kind of helped ease my mind about all of this. Catherine, we really appreciate it.
My pleasure.
We know you have to run. We have to run as well. Thanks for taking time for us this morning. All right, 7:56 now. Coming up, we're going to tell you which